your information precise whenever the case notes are given. Okay, I will share a few slides with you so you guys can understand what it exactly about. There is one slide. I'm not going to read it whole, but I will share this slide with you right now. Share. Okay, can you guys see the screen? Anybody? Okay, perfect. Okay, so this is a slide which is named as uh wait, I'm so sorry. Actually, I'm getting this. Just let me turn off my mobile. Okay, so sorry about this disturbance. Okay, so this is a slide. This is actually the ultimate guide to OET. I have downloaded it from the official OET website. Okay, it's a long slide. You guys can access to this slide by yourself. I'll share it with as well. So what exactly it is, because this is the most authentic information you will get. Okay, whatever the information you will get from third parties or second hand parties, those are not reliable sources. OET itself is the reliable source. Okay, so sorry, in this slide, as you can see, what exactly it is telling you, it is telling you introduction to the ultimate guide or to the OET writing subtest. Okay, what are the criteria? The criteria here mentioned are, as we can see, there are 6 criteria on which you are going to be assessed. Is first of all is the purpose. Okay, for example, what is the purpose of the letter? Is it a discharge letter? Is it as a referral letter? Is it an update letter? What is the purpose of writing that specific letter? Okay, second is the content. Okay, by content, what does that mean? As if you guys haven't seen any example, so let me tell you, you guys will be given long case notes. Okay, from that you have to take out the relevant information and then write it in that letter. For example, you have been given case notes of a patient, and in that case note it has been the information that is given to you is the patient presented with chest pain and he has been admitted in the hospital for the past week, and then past history, like he has been going through such surgeries, he had such medication and all that. Okay, but and you are asked to write a referral letter to a cardiologist. But now when you're writing, you have to see that always make sure that your letter does not exceed, I would say, 220 words. Okay, the safe limit is somewhere between 200 to 220 words. More than that you can write, but eventually you will lose marks because you have to keep your letter very precise. Okay, and they don't have, even in the practical, because it's not practical. Even if you take a practical example, whenever you are working in a healthcare setting, if you write a long letter, it will consume your time as well, and it will consume the time of that specific doctor as well. So it's useless to write long letter. Keep your letter between 200 to 220 words. Okay, and now you have to write the relevant information. For example, if there is a patient who has been admitted in your hospital with the complaint of chest pain, and now you have started initial treatment, and now you're referring him to the cardiologist, the relevant information is if if it is the first presentation, if he is on any blood thinners, on the antihypertensive medications, and if he smokes, or what kind of lifestyle that he is living. Okay, does he drink alcohol? These are some relevant information that you need to mention in your letter. What is irrelevant information? He has been married. Okay, what is his occupation? It doesn't matter. Okay, and then other things, if he has been going under like other kinds of treatment. For example, if he has any kind of minor trauma, it is irrelevant. Okay, it may be given there, but it is irrelevant. So you do not have to mention those irrelevant information. It will eventually make your letter long and you will lose marks, and also it will consume your time. Okay, the third one is conciseness and clarity. Again, as I mentioned, that you have to keep it precise, you have to keep it concise and very clear. If you are writing a referral letter, okay, then you have to make sure that you're putting relevant information and you are very clear about it. Fourth one is genre and style. I will tell you about it, organization and layout, and sixth is the language. Okay. So as you're writing letter, keep a format in your mind. You just try to keep it in 4 or 3 paragraphs, or maybe 5 paragraphs. The first paragraph or the first line should always be the purpose of the letter. Okay, that I'm writing this letter to this doctor, and this is a discharge letter, referral letter. Okay, the second paragraph should be the present history, the present complaint, or for example, you can mention that my patient was admitted in this hospital a few days back and with this complaint, and this treatment has been done with him. Okay, in the third paragraph you can write the relevant past history or past surgical medical history, and in the fourth letter you just keep you just make it the last paragraph very concise and say, now I'm referring because we don't have enough facilities, or he needs to be seen by a cardiologist and all that. Simple. If you keep it in the 4 paragraphs, I'm sure you will keep it between 200 to 220 words. Okay, let's see what's down there. Are you guys with me so far?
Yes, sir.
Anybody? Okay, perfect. Okay, so writing with purpose. The now what we are seeing is, what are the two parts purpose. The first part of purpose is making the reason for the letter immediately apparent. Okay, and in other words, making it clear why you are writing the letter and why the reader should read it. As I mentioned in the first paragraph, you should mention that I'm writing this referral letter or discharge letter or update letter in the first line, so the reader should know that what kind of letter this is and why is he reading that letter. By starting a letter with a clear explanation of its purpose, the reader does not have to spend time searching for what is important. This is important for healthcare professionals who are often are time poor. The second part of the purpose is sufficiently expanding the reason for your letter. What we mean by this is that the letter should build on what is initially outlined as the reason for the writing by adding relevant details. As I mentioned it already, that you have to keep it relevant and you have to keep it concise. Okay, again in chapter, why you're writing the letter. Okay, why should the letter be read, and does the letter start with a clear explanation? It all means that if you have mentioned in the first paragraph or not. Okay, what exactly is, there are some examples which we will not see at this time. You guys can read it on your own. I'm just trying to make you understand. um, Okay, these are the examples. Wait, I'll stop here and I'll share another slide with you guys. I will share this slide with you, and it's always better to read these slides or read this PDF on your own so you guys can understand. And as I mentioned, this is the only reliable source that you can put your trust on. Okay, and give it a read after this session so you guys can understand. Okay, any questions so far?
No, sir.
Okay. That's good. If you guys don't have any question, I am sharing my screen. Another. Okay. So this is another, again, this is from, as you can see, OET.com, the OET writing guide. Again, it is from the OET website, the most reliable source. So what here we are being told that each guide is based on a section of the assessment criteria we use to score your letter. What is the criteria that your letter will be scored on, or your letter will be assessed on? Its purpose, content, conciseness and clarity, genre and style, organization and layout, and the language. Okay, as we have read it before. Now, each of the above is assigned to a band score from 0 to 7, except for the purpose, which is given a band score of 0 to 3. If you are looking to get a score of 350 in writing, you will be required to score highly in each of the 6 criteria. Okay. To help you, we have put together 6 complete guides to the OET writing subtests that cover each of the criteria and what writing skills you will need and how to improve them. You can also download it as a PDF. So here they are. I'm not going to cram it all in front of you, but let's just give it a look and see what it is written. Writing with the purpose. Okay. You can break the purpose into up to two parts, immediately apparent and sufficiently expanding, as we have read it before. Okay, let's go to the other part. How to choose the right content. This is very important, and most guys, including myself, when I was sitting OET, I was very confused how to choose the right content. Deciding what information you put in your letter is hugely important. Without the right content, your letter will not be able to say the right things. Choosing the right information will depend on what the audience will need to continue caring for the patient. All the information you need for your letter is in the case notes. Okay. You will also need to be able to accurately represent the case note by transforming them into complete sentences and keeping the meaning same. Okay. So I think it's understood, is self-explanatory that you guys should choose the right information from the case notes, and sometimes you have to convert it into complete sentences. For example, if in the case note it is given that BP is equal to 120/80, you have to transform it, or you have to convert it into a proper sentence that the BP of that patient was normal, or it was high, and that is 150/100, 150/90. So these are some of the information. There may be some lab reports, okay? It will be given in the case note, but sometimes you have to convert it into the sentences, okay? You do not have to just copy and paste it. You have to make it in a proper sentence for that doctor so he can understand it, okay? And keeping the meaning same. Again, what does that mean? For example, if the patient has high potassium and you are writing that patient has hypokalemia, and then you are putting the value of the potassium in a higher manner. So hypokalemia means that potassium is low, not high. So keeping the meaning same. Okay. Next is what is next? Writing with conciseness and clarity. Again, we have gone through it that you need to decide what information is unnecessary and should be left out. Okay, this is all. If you need to understand what is this line is sufficient for you. Okay, what is next? The genre and style of your OET letter. What does it say? When you write a letter to another professional, it should be formal. Again, it goes without saying. The writing subtext reflects this and requires you to write a letter in the correct genre with the right style. To do this, you need to understand what formal writing looks like and how to write formally. This involves knowing you how to use both the right register and the tone. The grammar you use has a big effect on how formal or informal you sound. Using facts rather than judgments and starting and ending the letter correctly is usually important to your letter's genre and style as well. Okay. I think this is necessary that you keep tone of your letter very formal, okay, and you do not try to use words which you use in the informal setting of your speaking, like I have what can I tell you? Example can I give you? Some people try to, like, I'm gonna yes, you should not write in the letter that I'm gonna assess this or I'm gonna refer this. No, it is very informal term. Okay, it is a slang. You should not use these kinds of slangs or these kinds of terminology in your letter. The fifth one is organizing and laying out your letter. As I told you that you have to keep it in the four paragraphs and keep it in a chronological order, so you do not confuse the reader. In the first, you should mention the purpose. In second, you should mention that why he or she was presented to your hospital or to your clinical setting. Third is the relevant past history, and the fourth one is how you will end your letter. Let's say what this says is that how you structure letter has a huge impact. Okay, because every writing task is different. Every letter will be organized differently. There are several ways to organize your letter, including chronologically or thematically. You will also need to make sure you do not bury the important information under less important information. So it is true that every letter can be organized differently. What I have told you in the four paragraphs is just a thumb of rule. Okay, if you follow it, sometimes what you can do is you can start your second paragraph with the relevant past history rather than going on with the present information, a history of presenting complaint, that why patient was presented and what treatment has been given. Sometimes, given the letter, given the scenario, you can, yes, mold it and you can improvise. You can start your second paragraph with the relevant past history, and in the third paragraph you can mention the history of presenting complaint. But you should always keep this format in your mind. Okay, in that manner, when you are reading the case notes, you will understand, okay, this is the information that I need to mention, and these are the things that I need to left out. The sixth one, the last one, is using the right language. Each of the above criteria includes elements of language. However, these sections look at whether you have used them accurately. You need to be able to accurately apply elements of grammar, vocabulary, punctuation, and spelling to your letter. Okay. Now, this is also important. Why? Because let's say you start your letter and you say to the whatever the doctor, and you have put the comma, and at the last, when you mentioned yours sincerely, you are not putting the comma. So it doesn't matter. Okay, so in English, in American language, and in the we can say the in English used by the UK people or Australian people, it's different when it comes to that. It doesn't matter. So you can put the commas, but if you have put the commas after these, you should make sure that you are putting the commas throughout the letter. Okay, but if you have not put the commas there, you should make sure that you are not putting the commas throughout the letter. But that goes only for two with the subjects. In between, if you are switching from one information to the another information, it goes without saying, it is a punctuation thing. You should keep commas. Okay, you should keep colons, you should keep full stops, and you should also keep the paragraphs relevant. Okay. So it's ended here. Any questions so far, guys? Please let me know. Okay, so what I will share an example of a letter with you. Okay, I will try to explain how you can keep the relevant information there, how to pick relevant information, and how to convert it into sentences. But at the end of this session, what I want from you guys is, I'll be giving you a task. Okay, I'll be giving you some case notes, and I want you to write a letter and submit it by, it's Thursday today, submit it by Sunday evening. Okay, so I will tell you your mistakes and I will evaluate it till the next writing session, and there we can explain your mistakes and your shortcomings. Otherwise, these sessions are useless if I'm not getting your feedback, if I'm not seeing what kind of progress you are making. So I'll be giving you with this task. I will leave with this task of your with you, and you have to submit it by Sunday evening. Okay.
Okay, sir.
Okay, perfect. And with every writing session, today, as I am trying to teach you what is necessary and what is not, but what I will do from next on is, I will try to do, you guys tell me, is it okay if I give you the task at the whenever we have the writing session, or should I give you the task before the writing session, and in the writing session I evaluate and I tell you your mistakes? What do you think is suitable for you guys? Have you guys got my question? What I'm trying to ask you? You guys there? Am I audible or not? Nobody has responded yet. Khayyam, what I'm trying to say is that, is it okay that because I will be giving you writing tasks, okay, I need to see your progress, I need to see what kind of progress you are making, what are your shortcomings, so I'll be giving you tasks, okay, but is it
Sir,
suitable
before
that,
starting the session, share me one task, sir. So we'll go through the. Yes, sir. We'll go through that and we'll come to know where we are lacking.
no, Jayashila, what I'm trying to ask you is that, if I because today's first writing session, okay, I'm trying to explain to you that this is important in the writing session, and this is how you take or how you write the letter, what kind of letter, whatever the kind of letter you have been given. So today at the end of this session, I will be giving you a task. But what I'm trying to ask is that, if, whenever we have the next session, is should I give you the task before the session or at during the session, and I check it and I evaluate it in the next session, and we'll discuss those letters in the next
Before the
session.
session, it should be more.
Okay, so for that, if I give you before the session, so then you guys will be needing to write two letters. One task will be giving
Yeah, yes.
yeah. So is that okay with you guys?
I'm okay. Others, sir, I don't know, sir.
Okay, perfect. So one, I will be giving you one task today, and the other task I will see when is the next writing session, and I'll give you one or maybe a couple of days before, and we will then discuss both of those in the next writing session. Okay? Okay, perfect. Okay, let me share a slide with you guys. Is okay. Can you guys see the screen?
Yes, sir.
Okay, perfect. Okay, so this is, an example of a letter. What does it say? It says writing subtest time allowed 45 minutes. Okay, you will be given, sorry, 45 minutes. So how do you divide your time? How do you manage your time? Because 45 minutes, it seems that it is a very long time, but in the exam setting, I'm telling you that you will be needing more time. So 45 minutes are gone in a blink of eye. So what is a good practice is that you keep 5 minutes for your reading and you start writing in the 40 minutes. After 5 minutes, you are not, actually you're not allowed to write in the 5 minutes. Some examiner will not allow you to write. They will give you 5 minutes to read, and after 5 minutes, they will tell you now you can start writing your letter, which is a good thing. Okay. In those 5 minutes, take your time. Do not rush. Okay. Do not rush, because if you are good at reading, if you are good at going through the notes, if you can, just try to understand what is given and just try to make a very good, what I will say, format in your mind. Trust me, even 30 minutes are enough when it comes to the writing. But if you are rushing, if you say, you know what, just let me go through 2 minutes, okay, this, trust me, even 45 minutes or 43 minutes will not be enough for you, because you will be switching between reading and writing, and that will consume your time and you will stress out. So 5 to 7 minutes is a good time, which you should just read the letter, just go through the notes, try to understand what exactly is given, what is the necessary information and what is the unnecessary information, and try to make a format in your mind and then write it. It's okay if you sometimes you have to erase something. It's okay, it's fine. You will be given a lead pencil, you will be given the soft pencil, you can always erase and you can always amend it. But as I said, it's a good practice to keep it, to take your time. Okay, take your time. Give yourself 5 to 7 minutes to read the case notes. Okay, let's see what is given here. Read the case notes and complete the writing task which follows. Okay, so what does it say? Assume that today's date is 12th September. You are the attending physician responsible for Mr. John Smith, a 45-year-old office manager who has presented with chronic lower back pain. Okay, okay, what is next? Patient details. What are the patient details? The name is Mr. John Smith. Date of birth is 20th of September 1977. Social background single, office manager, sitting for most of the day at work, little exercise, poor posture, history of smoking, and he has quit smoking 3 years ago. What is the medical history? Known hypertension, which is controlled with medication, type 2 diabetes, well controlled, family history of heart disease, and no known drug allergies. What are the current medications? Amlodipine daily for hypertension, metformin 1000 mg twice daily for diabetes, over the counter ibuprofen 400 milligram as needed for pain. And now, as I'm reading over-the-counter ibuprofen as needed for pain. For now, in whatever I've read through, what is the pain that he is taking this ibuprofen? Can anybody tell me? So far, what has been mentioned in the case notes for which Mr. John Smith is taking painkiller? Guys, I'm asking you, anybody can tell me for what problem he is taking the painkiller? For what pain exactly?
Sir, it's because of poor posture.
No, not the poor posture, back pain. Exactly. Sadia and Salman, yes. Perfect, perfect. See,
Lower back pain.
yes, exactly. Perfect. This is what I mean, that you guys should take your time while reading the notes. Okay. So far, we have read only one page. Okay. And in this page, we have seen that he's hypertensive. It is written that it is controlled with amlodipine. He's diabetic. It is well controlled with metformin. Okay. He's taking that twice daily. And in the above, it is mentioned that he had chronic lower back pain. Okay, and he is office manager and sitting for most of the day at work, little exercise, poor posture. So we can see the pattern. Okay, and for that he is taking the over-the-counter ibuprofen and as needed for the pain. Okay, what's next? What is next in the case notes? Now, history of present illness, experiencing, as we see, before reading the history of presenting illness, we have actually you know defined, we have actually sensed that what exactly is going on with this patient. As I told you in the first page, if you if you are aware, if you're attentive, you have read that he has chronic lower back pain, he is sitting for most of the day, he has little exercise, poor posture, and he's office manager, and his most of his work involves sitting. So we actually sense that the problem can be lower back pain. And now see, history of presenting illnesses experiencing chronic lower back pain for the past 12 months. Now, the nature of the pain is dull and aching, primarily in the lumbar region. There is no radiation of pain to the lower limbs. Pain intensifies, fluctuates, but is generally moderate, 6 to 10. Pain increases with prolonged sitting or standing. No history of trauma or recent heavy lifting. Tried over-the-counter pain relievers with limited relief, no bowel or bladder disturbances, no significant weight loss or night sweats, and no fever or chills. So, in this case, no history of presenting illness, what we have seen so far is that he has been experiencing chronic lower back pain for the past 12 months, which is dull in nature, aching, non-radiating, mild to moderate in intensity, and the pain fluctuates and it increases with prolonged sitting or prolonged standing. That's it. Okay. And the one thing that we have seen so far is there is very limited relief with ibuprofen that this patient has been taking over the counter. Okay. Now, this, let's see what is mentioned, 17/9/2023. What was the date? What was the date? Anybody can tell me that I have read in the starting of the letter? It's okay. If you guys do not remember, see, it was written, today's date is 12th of September. Okay. Okay, what are the investigations? Investigations is X-ray lumbar spine, which shows mild degenerative changes in lumbar vertebra. Hemoglobin is 6.2, indicating good, sorry, not hemoglobin, HbA1c is 6.2, which indicate good glycemic control. What is your assessment? Chronic non-specific lower back pain, hypertension is well controlled, diabetes is well controlled. Now, what is your plan? Your plan is, sorry, yes. Your plan is refer to physiotherapist for exercises and posture correction, physiotherapy twice weekly for lower back pain, and advice on posture, exercise, and a more active lifestyle. Occupational therapy assessment for ergonomic workplace modifications. Now, what is the analgesic management? Analgesic management is avoid long periods of sitting or standing. Consider prescribing short course of NSAID if pain persists. discontinue current antihypertensive and anti-diabetic medications. Lifestyle modification is encourage regular exercise, follow up at appointment in 4 weeks, referral to the pain clinic if symptom persist despite conservative management. What is your writing task now? Your writing task is you're using the information in the case notes, write a referral letter to Mrs. Carter, a consultant physiotherapist, summarizing your assessment and outlining your recommended management plan for Mr. Smith chronic back pain. Address the letter to Mrs. Emily Carter, lifestyle physio, to a 55 commercial road meta. In your answer, explain the relevant case note into complete sentences. Do not use the note form, use letter format. The body of the letter should be approximately 180 to 200 words. Okay, so far you have read the letter. Anybody, even if you can type, can you just give me a little format how you will take on this letter and how you will write it? I need to know what you guys have understood so far. I will stop sharing the screen. Okay, but wait, let me share the screen. Wait, sorry. Okay, anybody, how you will exactly take on this? People, I'm trying to ask you how exactly will you take on with this letter? How you will write this? Please do not make me call out your names. Anybody? Khayyam, Sadia, Salman, Khatija, Jay, Shila, Mansha, anybody?
I didn't understand your question. Please repeat again.
Sorry?
I didn't understand your question. Please repeat again.
My question is that we have read the case notes. Okay, I have explained to you how you should write a letter. Now, reading the case notes, you have read the case notes. Can you give me a little bit of structure, a little bit of format, and your understanding so far how you will write this letter, how you will write this referral letter?
Oh, okay, sir. Show me the task.
The task is, see, this is the task. The task is
Okay.
you're using the information in the case notes, write a letter of referral to Mrs. Carter, okay, physiotherapist, summarizing your assessment and outlining your recommended management plan for Mr. Smith chronic back pain. So this is your task, and these are the case notes.
This is the
Okay, sir.
referral
First of
letter,
all,
sir.
Yeah, this is the referral
referral.
letter. This is exactly my question, that now you have read the case notes, you know that this is a referral letter. You have read the case notes that Mr. Smith has chronic back pain for the past, 12 months. He has tried medication and it is not working, and you have done X-ray which shows degenerative changes in the lumbar vertebra, and he is an office worker, and your recommended plan is to refer to physiotherapist and avoid long periods, have some lifestyle modifications, and if the pain persists, he should try NSAIDs, and should make a follow-up in 4 weeks. See, I have written so much information, and I have written so much information. So what I'm trying to ask you is, can anybody explain to me? You do not have to be perfect. Just try to explain how you will write this letter. I've actually wrote this letter, and I will share that with you. But before that, I need to know what is your understanding. Where do you guys stand?
सर राइट नाउ अभी लिखना है या आपको वर्बली बताना है कि कैसे लिखना है?
You can tell me verbally.
ओके सर, फर्स्ट ऑफ ऑल जिसको हम रेफर कर रहे हैं पेशेंट को, सॉरी डॉक्टर को, उस कंसल्टेंट नेम एंड
Mancha, I'm understanding, but I will encourage you to speak in English, because in that manner, your speaking ability will also improve.
okay sir, first of all we will write the consultant and his specialty and
Okay,
address, and then his date, and then we will
okay,
write dear doctor,
okay,
dear doctor and his second name.
Okay, perfect. Next, what?
Then referral RE and the patient name, full patient name,
Okay,
and if his age is mentioned, then we will write date of birth or age in front of this same line.
okay.
After that, I am writing this. I am writing to refer Mr. Simit, second name, Mr. Simit, who has been
Mm-hmm.
diagnosed with. Sir, show me the diagnosis. Who has been diagnosed with?
There has been no
Sir,
diagnosis of him. So there is actually no
Who is
diagnosis. The only,
suffering from?
who is
yes,
suffering from? Who is suffering from this condition? And your further assessment and management would be highly appreciated. Or your further
okay.
care. Sir, after that, I will in second paragraph, uh, Mrs. Smith uh,
Mr. Smith,
is
not
a
Mrs. Smith.
सॉरी मिस्टर सिविल सर एक्चुअली ये जो पूरी जो इसकी इंफॉर्मेशन है ना ये है नहीं ना इन फ्रंट तो इट्स डिफिकल्ट हो गया
No, if you want me to keep, I can actually scroll down and up if you want me to. That's no problem.
सो मिसेस स्मिथ सॉरी मिस्टर स्मिथ is a
Yes.
single office manager. Uh,
Okay.
uh, he's a single officer manager, and during his job, he's uh,
He what?
so like I mentioned, करना चाहूंगी, I like mention to that he's sitting all the time, not doing any physical activity, and he is a
Okay.
smoker, and he's a
Okay, I'll stop you here. I'll stop you here. Why do you need to mention the history of smoking in this letter? Why? Is it relevant?
no sir, maybe not
Exactly.
Not
even
It's not
relevant,
relevant.
sir. Not
Sorry?
relevant, sir.
Yeah, exactly. It's not relevant.
not relevant.
You should not mention
Because
it.
we are referring to physiotherapist.
Exactly. So,
Okay,
smoking history, even if it's mentioned here that he has quit smoking 3 years back, even if he is a chronic smoker, you should not mention it because it does not has to do anything with his chronic back pain. Nothing, absolutely nothing. Okay, Mancha. Okay, so now you have mentioned that Mr. John Smith,
okay sir.
he is an office worker
And
who is
her
sitting most of his day. Next, what you will write?
his classmate, well, his sir,
Okay, and keep going on. Let me just try to understand. Just give me I
hello,
think yes, I can hear
hello.
you.
Sir, I
Just
have
just
signal
give.
problem. Yes, sir. Sir, after that, I will his past medical history include hypertensive and diabetic, for which he was taking imlodipine 5 mg and
Okay,
metformin 10,000 mg twice a daily,
okay,
as well as he is taking 400 mg for pain.
okay. And next word.
And experience it. Okay.
Okay, it's good so far. I can see it's so good so far. Jay Sheila, can you please tell me how you will attempt this letter?
Same data only. How she was explaining the same thing only. In the last paragraph, we'll mention it would
No,
be
no,
great.
no, no, not same. No, I want you to explain it to me, since the start.
Okay, sir. Yeah, first, we'll mention the date and we'll mention the who are referring. Just a minute, sir. I'm not able to see in the screen. Please go little bit side, sir.
Okay.
Right
Should I
side, sir.
go?
Right side. I'm
No,
not able to see the screen, sir.
I have shared the screen. What exactly is?
Address. We have to mention the address next to the date.
Okay. Address. You have mentioned the address next.
Then we'll mention the REF and we'll mention the patient name. And if it is the age, we'll mention age or date of birth.
Yes.
Then I'm referring to patient again. Will Mr. John Smith, who is
Mm-hmm.
suffering from the chronic lower backache.
Okay.
Okay.
And next, and now that you have mentioned the purpose, now you have mentioned, that Mr. John Smith, who has been experiencing chronic back
Who,
pain. Now, in next
yes, sir.
paragraph, what you will write, what you will mention?
In that investigations, what are the investigation we have done in the where we have related or where we find out why he is getting a chronic severe so chronic backache.
Okay. And so it's okay. I will tell you, Jai Sheila, no problem. The
Yes,
only thing, Mansha, I forgot to correct you there is by REF, you do not mean referral. It means reference. What is the reference of that patient? Okay, it means reference. Okay.
we have to
Just
mention the full reference or REF two
no,
dot is enough, sir.
REF is enough. You do not have to write.
Ah,
Just
Okay.
RE or
REF,
REF?
REF,
REF.
REF. It means reference. It not means referral. Okay.
Yes, sir. Yes.
Sadia, Salman, Khatija, Khayyam, anybody, can you guys tell me how you will attempt this letter? It's actually quite easy one. Anybody? Okay, I think no, everybody is not interested. Let me share you. Let me share my attempt of this letter. Okay, see. So, what first of all, what we will go through it. Today's date is what have we assumed that today's date is what 12th of September. First of all, we need to make sure this is what you have. And now when we'll scroll down, when I'm starting my letter, I am putting the date on the top. It's 12th September 2023. Okay. Whom I writing the letter to? Mrs. Emily Carter, who is what lifestyle physio, 25 Commercial Road and Merton. See, I have not put any commas here and I will follow this pattern throughout my letter. Okay. I will not mess it up. This information that I have taken is, where did I take it from? From here. Uh, here. See, Mrs. Carter, consultant physiotherapist, lifestyle physio, 25 Commercial Road, Melton. So this is how you will always start your letter. You will put the date at the top, the name, the his or her level or his what is his lifestyle physio, cardiologist, whatever, and then the address 25 Commercial Road and Merton. Okay, now what? Dear Mrs. Carter, always use the second name. Now, RE, you can also put REF, but RE is also fine. Mr. John Smith, date of birth 29 1977. If you are good at maths and you can calculate the age, it's good. You can do that. If not, then just write this. Uh, in most of the letters, the age is given. In the next paragraph, what I will do, let me share this. Yes, that I'm writing to refer Mr. John Smith, a 45-year-old office manager for physiotherapy management due to chronic lower back pain from which he has been suffering for the past 12 months. In the first line, what I have done so far is I have made one paragraph, but what you can do is the next Mr. Payne's Mr. Smith's pen is described. You can also start it as the second paragraph. It depends on you. Okay, if you want to make your letter more concise and more precise, you can do that. But you can also join it in the first paragraph. In the first line, I am very clear what is the purpose of the letter. Okay, I'm writing to refer, and what is the problem for physiotherapy management, and what exactly is the cause due to chronic lower back pain from which he has been suffering from the past 12 months. So in one line, in one sentence, I have given enough information to the physiotherapist that he is in office, that he's 45 years old, he's office manager. I'm referring for the physiotherapy management. What is the cause? Chronic lower back pain from which he has been suffering for the past 12 months. Okay, now that I've mentioned enough information in the first paragraph, in the second line or in the second paragraph, what you will say, Mr. Smith pen, Mr. Pitts is described as dull and aching, primarily localized in the lumbar region with an intensity that fluctuates but is generally moderate. His condition worsens with prolonged sitting and standing, though no radiation of pain to the lower limbs has been reported. Notably, Mr. Smith has no history of trauma or heavy lifting. So, in the first paragraph, I have mentioned that he has chronic back pain, and now with that, I have also mentioned the history of that back pain, that it is dull and aching, and it is localized in the lumbar region. It is non-radiating. It is moderate. He has no history of any trauma or any heavy lifting, and it worsens with prolonged period of sittings and standing. So in the first paragraph I mentioned, in the second paragraph, now I am actually explaining the his lifestyle or his past medical or surgical history. If there is any surgical history, Mr. Smith leads a sedentary lifestyle characterized by long sitting hours at work, minimal exercise, and poor posture. He also has a medical history of chronic hypertension and type 2 diabetes with no known drug allergies. His current medication include amlodipine for hypertension and metformin. Over-the-counter ibuprofen has provided him limited relief for his pain. Okay, now that I've mentioned his past medical history, his lifestyle. Now, what we have done some investigations, we have performed X-rays as well. Now, in the third paragraph, I will explain that recent investigations revealed mild degenerative changes in the lumbar spine, but good glycemic control. Given this context, I have recommended physiotherapy to focus on exercises and posture correction alongside advice for adopting a more active lifestyle, and occupational therapy assessment for ergonomic workplace modification and also being planned. Okay, so in the first three paragraphs, you have explained the pain, the relevant past history, and your assessment and your management plan. Okay, in the fourth paragraph, which is the last paragraph, you need to close the letter. How you will close it? You will close it and you will say, I believe that your expertise in physiotherapy will greatly benefit Mr. Smith in managing his chronic back pain. Your assessment and recommendations for his treatment plan would be highly appreciated. Thank you for your attention to this referral. Yours sincerely, and then at the end you will write XYZ. Okay, so I believe this is around what 180. I think it's less than 200 words, and in less than 200 words, I have explained everything. Do you guys have any question? Okay, somebody has a question.
Sir,
Can you summarize?
actually,
Yes, yes, please
डेट जो
ask.
मेंशन डेट जो मेंशन की आपने, वो टुडे डेट होती है जो लेटर पे मेंशन हुई होती है, वो करनी होती है?
No, whatever the date is, it sometimes you will be given with the date in the letter. Okay, if you are given with the date in the letter, you should mention that date. Otherwise, if you are not given any date, let me give you an example. Okay, here in this letter, for example, here I have mentioned that assume today's date is 12th September. Okay, sometimes you will be given with this date, but sometimes you'll be not. Sometimes you'll be given with what? Wait, is it? Sometimes you guys will be given like this. See, this is the date here. 12/9/2023, and these are the investigations that you have done. So it's understood that this patient has presented to you for the very first time, and this is the date that you have been given in the letter, and this is the your investigation and assessment. So in this manner, in these scenarios, you have to mention the date. Otherwise, if you are taking the exam on, you have to mention that date. Khayyam, I was offering prayer. Okay, Khayyam, what was the last thing that you have attended? Please tell me so that I can summarize. Jay Sheila, are you
Yes,
there?
sir.
So have you
Yes,
seen
sir.
this letter? Have you seen how
Yes,
I
sir.
have?
Yes, sir. Yes, sir. So
So
in
now
that
you
I had
understand?
one doubt, sir. Yes, sir. I understood, sir. In that, if the in the task, if they given multi dates, for example, today he came and he recovered with a backache and he left from hospital, and again he came back with the other complaints. So in that scenario, which date we should mention in the top of, sir?
In the top you should always mention, for example, what you are asking is if there are multiple dates given,
Yes, sir. Exactly.
those multiple dates will be given with a past history. For example, if today's
Uh,
date is 12th September, you will be given another date of, let's say, 5th August, okay, then
okay.
maybe 4th of July. So you need to understand that this is in the past. So
Past.
yes, sometimes in the letter you should mention that last month he presented
Mm.
with the same complaint and we did this, and before that, or you can say on multiple occasions, he has presented. I have a few letters with these case notes. I have not
Yes, sir.
used them right now because in the first session it will be
Yes, sir. Yes.
very confusing for you. So don't worry, I will tell you
Okay, sir.
and I will guide you as well how to attempt those kinds of letters as well. But this was a very, very basic letter and it was actually very easy because in this letter you do not have to filter so much information. Okay, whatever the
Okay, sir.
information is, it's actually very you can say relevant. Only thing that you had to filter in this letter was smoking. That's it.
Oh, okay, sir. And thank you for your attention to this referral. Thank you sincerely or you are faithfully, sir.
Sorry, thank you. What?
Thank you sincerely. Last point you have mentioned. Thank you for your attention to this referral. You
Yes.
were sincerely. I mean,
Yes.
whoever is the doctor name, nurse name, we will mention here in this department, in charge nurse or physiotherapist. We will below the in space we are mentioning. Above that,
Yours
shall
sincerely.
we?
After
You are
yours
sincerely.
sincerely.
After sincerely, not faithfully.
No, you can actually write yours sincerely. You can actually write yours faithfully. But is your question that after yours sincerely, what should we mention? Is that your question?
Yes, or sincerely or faithfully. Which one we can mention in
You
this?
can mention sincerely. You can the good thing is to mention sincerely, but faithfully is not very right. Faithfully is used for person who you know very personally and with whom you have been in contact in the past, and or with whom you have good terms with. But maybe you
Okay.
are referring for the very first time to this physiotherapist, so it is a good practice to write yours sincerely rather than your faithfully. Okay.
Okay. Your sincerely is the perfect word for all the letters.
Or the letter, yeah, it
Yeah.
or the letter.
Oh,
And after your sincerely, you have to put XYZ. You do not have to mention your
yeah.
name. Okay, you do not
Yes,
have
yes,
to
sir.
mention your
Either you in charge or physiotherapist or doctor, whatever they have given in the task.
name. No, your sincerely. No, 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 no. After your sincerely, just write XYZ. That's it. That's it. You do
That's
not
all.
have to
X,
mention.
Y, Z.
Yes, XYZ. That's it. You do not have to mention. Yes, you can write Dr. XYZ, but that's it.
Uh,
You do not have to give any clue to the examiner because it will actually deduct your marks or maybe cancel your letter because in that manner you are
Okay.
giving out your personal information. So maybe there is a chance your letter will be cancelled in a way that you are giving out
Okay.
personal
Okay.
information. So you do not have to mention your name or given the fact any name. Just write Dr.
Professional
XYZ.
designations. Okay. Okay, sir.
Okay, you can write your
Oh,
professional designation if you're a nurse, if you're a physiotherapist, whatever, with
uh,
XYZ. That's it.
X, Y, Z listed. Okay, sir. Okay.
Yeah.
Thank you, sir.
And see, in this also, I haven't mentioned there is one thing I have actually given this task to one of my friend as well. And when he attempted this letter, he actually mentioned that Mr. John Smith, a 45-year-old office manager who is living single, who is single, you do not have to mention that. It doesn't have to do anything, whether he is married, whether he has kids, whether he is a
Yes,
divorcee,
sir.
whether
Yes,
he's a
sir.
widowed. Okay, so these kinds of
But
things.
uh,
Yes.
but when we are writing the social history, by the time we have to mention the whether he married, single, and his habits also we need to mention the paragraph, right,
No,
sir?
but see, in this letter, if you yes, in this letter, it is very necessary to point it out his social history or his social background. But what is
Not
relevant
required.
is he being
Is-
married or is he being widowed relevant to his chronic lower back pain?
No, sir. No, sir.
Exactly. In other manner, if there was given that Mr. Smith, as it mentioned that he led the sedentary lifestyle with little exercise, but if it has been mentioned that he goes to the gym, it was relevant. Maybe he was lifting weights there. Okay.
Yes, sir.
Also, one thing, can anybody tell me? We have mentioned here that he has good glycemic control. We have actually put out the value of HbA1c. Why is it relevant here? Why?
To be. For this is on medication which is in the metform, again it shows 6.2.
Yeah, but we have mentioned that, his current medications include amlodipine for hypertension and metformin, and we have mentioned that, he has a medical history of controlled hypertension and type 2 mellitus. But why did we mention this specific value, 6.2? Why did we mention that he has a good glycemic control?
Because he is maintaining his.
Okay, so there are two factors why we have mentioned. First, or two reasons. One of the reason it shows that his diet is good. Okay,
Yes,
even
yes,
though he lives very poor sedentary lifestyle, still his diabetic control is good. Okay, so
mm.
first of all, it shows that his diet is good, even though he has a sedentary lifestyle. Second one is that it is a good practice to mention glycemic control, because if we have to start this patient on NSAIDs or something like that, it sometimes induces its reaction with NSAIDs as well, metformin sometimes react, or sometimes other diabetic medication, they react with the painkiller. So it is always a good practice to mention the glycemic control, if he has a good glycemic control or not. Okay,
Okay, sir. Understood, sir.
because sometimes if you do not have the good glycemic control, what are the complications of diabetes? Nephropathy, neuropathy. Okay, so
Neuropathy. Yes, sir.
exactly, nephropathy as well. If you are giving some medications, what
Definitely,
is
sir.
the
It will
clearance? It will be cleared by kidney. So if he
yes,
or she
it
does
will
not
affect the
have good
kidney.
glycemic control, we are mentioning that he does not, his kidneys are not up to the task of clearance that.
Task.
So that's why it is a good thing to always mention, glycemic control as well.
Mm. In case in that scenario, if they given a creatinine level also, we should mention in the next to the point, sir.
It depends. See,
If they
Jashila,
given
it all depends on the context. It all depends on the case notes.
context,
If it is relevant, you should mention. If it's not relevant, you should not
not
mention.
required. Oh,
Okay.
okay, sir.
Any questions so far? The thing is, I have another letter, but I will not show it to you because that is the letter I will be giving you as a task, and I want you guys to write that. But we have the session, we have the time. I want you guys to give your input, whatever the queries you have so far, so I can know. Dr. Tabinda, welcome. You have joined very late.
Yeah, sir, I was sleeping. Sir, I want to ask you one thing. Sir, I heard an urgent letter, like if you want to going to urgently refer some patient. So in the first paragraph, after introduction and after purpose paragraph, you have to write the current complaint. Is it correct?
Yes, it is correct. That is exactly what I have told these guys, that it is a good practice that you know when you have written that, one second, yes, when you have written that I'm writing to refer Mr. John Smith for physiotherapy management to chronic lower back pain, for which he has been suffering for the past 12 months. Now in the next paragraph you should always mention the current. If it is an urgent letter, you should always mention the current thing, that Mr. Smith presented with an acute chest pain which lasted for 30 minutes, so it was non-radiating. So the current thing, you should always, if it is an urgent letter, you should always start with the current management or the current complaint. Otherwise, you can also, in this letter, you can also attempt it in a different manner. You can also attempt it in this manner, that Mr. Smith presented with chronic lower back pain which has been going on for the past 12 months. And you can also mention that we have attempted some investigation which shows this. And in the next paragraph, you can also mention sedentary lifestyle. So there is no hard and fast rule, as long as you are following an order. Okay, you are not jumping around the information. For example, you have mentioned the pain history here, and again you are mentioning the pain information in the third paragraph. If you're not jumping around, if you're sticking to one thing and if you're following an order, there is no actually hard and fast rule. What I have told you so far is that the four paragraph rule is just to make you guys understand that you should always keep a format, and with that you can play. Okay, there is no hard and fast rule. We have gone through the OET website, and they also said that there is no hard and fast rule. You can also play. Okay, every letter can be written different. This letter can be written differently. Okay, I am sure that somebody will write it differently. So as long as you are not jumping around, you're sticking to the point, you're keeping the relevant information, okay, and keeping it very precise and to the point, you're good to go.
Sir, in the sorry, sir, in the referral letter, in the simple referral letter, we have to write the purpose. Then we can write
Mhm.
the social history.
See,
Like,
in this letter, I have written the social history in the second paragraph. Okay, you can write the social history, but you should also see if the social history is relevant with the case notes or not. For example, in this
like,
case, in
yes, sir.
this,
If they are giving advising to reduce smoking, I can see that in the second or third paragraph, I have to write. So I want to write that she's a smoker of 10 to 15 cigarettes. So I have to write in the first it.
no, if you want to write the smoking history that the person has been a chronic smoker, again, if it's relevant, then yes. If it is not relevant, then why do you have to, for example, in this letter, in this, it has been mentioned that he has quit smoking 3 years back and he has been a chronic smoker, but we have not mentioned it because it is not relevant. For example, if this case was if the complaint was cardiac arrest or chest pain, yes, smoking history is relevant. You should mention that he has been a chronic smoker for the past 15 years, and in the last paragraph you can say that my assessment is, or my recommendation is, to adopt a more active lifestyle and cut down on smoking. Yes, it is relevant, then you should mention it. If it's not relevant, you will just drag it and you will lose marks.
Sir, which form of sentence we should use in the letter? Like some mentor told me that if you don't want to do any mistake, use past tense. Is that correct?
It is correct, but it depends as well, because see, whenever you are writing the letter, you are actually giving the info, the person whom you are writing the letter, you are actually giving him the past information or her the past information, that what has happened so far, okay, and what he has gone through so far. In this letter, I have also adopted a past letter, but for example, let's see this. Given this context, I have recommended physiotherapy to focus on exercise and posture correction, and occupational therapy for ergonomic workplace modification has also been planned. But now this is not past tense, or this is not in the past. This is present. What I have assessed so far, and what is my recommendation. Other than that, if you are explaining past history or what he has been going through so far, yes, you should adopt past tense, but it depends as well. If you are giving some recommendations, or if you are giving your modifications, then you should write in the present tense. Khayyam, I asked you, no problem, Tavinda. Khayyam, I asked you what was the last thing that you heard before you went for prayer, so I can summarize it. I get it. Nothing's okay, no problem. Okay, other guys, Sadia, Salman, Khatija, do you guys have any questions so far? Sir, about commas and punctuation. Dr. Tavinda, yes, you should always keep commas and punctuation. For example, see, a 45-year-old manager, then comma, because you are now giving another information for physiotherapy management due to chronic lower back pain. Okay, commas in the body, in this part, you should always keep the punctuation. But I think you were not present in the about connectors. Yes, connectors. See, English as a rule, should we mention dates in the letter? Khayyam, I will tell you that about that more in the future. I have some letters where there are so many dates given in the case notes. Sometimes, yes, you have to mention dates. Sometimes it's not necessary. Okay, it depends on the case notes. I have a few examples, and we will discuss in the coming writing session. Okay. Dr. Tamita, about your question, see, in this body, which is the letter body, you should always be very, very careful about connectors and about commas. If you are writing in such manner, yes, you should keep the punctuation properly, because if your punctuation is not good, you will lose marks. They are assessing your writing ability, and this is your writing ability, how you are using your punctuation, how you are using your grammar. So these are the things that you need to be very careful about. But in this part, see, and leave this part where you have mentioned the address, the date, and the name. If you're not putting the comma after every word, it's okay, but you have to keep it like this throughout the letter. Okay, but if you are putting commas, then you have to put these commas at the end as well. Sadia, Salman, and Khatija, I haven't heard anything from you. Are you guys there? Are you attending the session? Dr. Tavinder, please feel free to ask.
Sir, I want to ask about the from where we have to count the letters. Like someone told me that you don't have to count the address in the letter and the closing sentences, like to complete it 180 to 200.
See, the thing that will be counted is this part. Okay, this body of your letter will be counted. Okay, yes, they are right. Your address and your sincerely, they are not counted as the body. They are not counted in whenever they are counting the number of words or letters. But this letter, this body, this is this is what it will be counted, and this is on what you will be assessed majorly. Khayyam. Yes, Khayyam, I will share this letter with you guys in the WhatsApp group. No problem. And for those who have joined now, or for those who have missed, with this, I will be giving you a task, a writing task that you guys have to attempt, and you guys have to submit it by the Sunday noon or Sunday. I would say yes, Sunday noon. Before Sunday evening, till Sunday noon, you guys have time. You guys have to submit those writing practices. Yes, I'll be giving you a task, okay? And by Sunday evening, please submit it. Anybody who has not submitted till Sunday evening and submitted after, please, I will not assess it, because I need my time as well to assess and see what you guys have been lacking. And before the next writing session, a couple of days or a day before, I will be giving you another writing task, and you have to attempt it. And both of these tasks, we will discuss these tasks in the next writing session. Okay, this is how you actually improve by practice. It does not matter if I'm here talking with you guys. If you're not practicing by yourself, you will not improve. Okay, this is how I'm going to help you. I will be giving you two tasks. One task will be giving you today, and the next task will I will tell you before the next writing session, and I will assess both of them, and we will discuss those, and I will tell you your mistakes and how you can improve. I'm sure you guys will attempt them very good. But please, while you are writing those letters, try to keep a stopwatch by yourself, okay? And try to just practice in a way that you are in the examination scenario, you are in the examination hall, okay? Please do that, because if you do not practice that right now, you will mess up in the exam. Anybody has any question? So you can yesterday recording. Khayyam, it will be shared with you by the admin. Yes, you can have the recording. I actually do not have access to that. I will ask the admin and they will share the link with you. Okay.
Sir,
Gigi,
if
yeah.
patient having multiple visits for the same problem for the same disease. So we can write that on this date patient on initial this date patient was coming to me or was presented to me this and the last paragraph should we write that today's visit he was again reported to me there date
So
I was
your question is if there is multiple complaints on multiple
yeah
dates,
time.
so you have to mention those all. Is that your question?
Yes sir.
Okay, Dr. Mancha, as I've mentioned that I have a few letters with those examples where in the case notes you are given so many dates and it's actually very confusing. For now, for the first day, I have kept it very simple so that you guys can actually understand what is writing about and you can understand and have a little bit of understanding when in the next couple of sessions we will try to attempt those letters as well. For your question, you do not have to mention every date in the letter, but sometimes you have to mention few dates as well.
Not
Few
every date,
dates.
initial date and today date, but in between I will mention that after 4 week or after 10 days like this. Not
Yes,
every
you
date, but I am asking about first visit and today's visit on coming day.
you can mention that, but it also depends that if the first presentation was because of the same complaint, okay, and is he has improved after that first presentation or not, you can mention at first presentation. But some see, these are the questions I can understand your question, but these are the questions that are really hard to answer because it depends on the context of the case notes. If the case notes are given in such manner where you have to mention the first presentation and subsequently the other presentations, yes, you have to mention each and every visit, but sometimes you do not have to mention each and every visit. You just have to mention the relevant visits and you have to mention the relevant dates as well, just in the in a manner that you are showing the doctor which you are referring to that he presented, let's say 3 months back, and now he has presented again with the same complaint which is not improving, and this is actually one of the reason that I'm referring this patient to you, because it's been going on for the past 3 months and he has been on the medication on the same treatment, so it's not improving. So sometimes, yes, in this context you have to mention dates, but it depends on the case notes. I have a few letters of the such examples and we will discuss those. Just try to calm yourself, have an understanding of how to attempt this letter. I'll be giving you a task and you attempt those tasks and then we will discuss it subsequently. Okay, do not worry about that.
Okay. Okay.
Any other question?
Sir, if we are finding some symptoms in a letter like we are suspecting that patient has colon cancer. So can we write on the purpose that sign and symptoms are suggesting of colon cancer, or we have to write that patient is having bloody diarrhea?
Okay, sorry, I have just seen your message. So if you are writing, I'm writing to refer Mr. John whose signs and symptoms are consistent with bronchogenic carcinoma, your further evaluation would further. Yes, you can write that, but you can write it that I'm writing to refer Mr. John Smith whose signs and symptoms are consistent with bronchogenic carcinoma for further evaluation of a endoscopy or of a colonoscopy. Your further evaluation would highly be appreciated. It does not looks right in the first line. Okay, you can always write. You do not have to write bloody diarrhea. You can write the bronchogenic carcinoma because you are writing the letter to a medical professional. You are not writing the letter to a layman person. So yes, you can use the medical terminology. You should not use the symptoms.
Sir, so we have to write that your further evaluation in terms of endoscopy would be highly appreciated.
No, it's
Like,
not actually. See, it does not sound good. For example, if I am reading, if I am, let's say, a gastroenterologist, and I'm reading the letter, and the first line, the doctor has mentioned your further evaluation would highly be appreciated. It's understood if you're referring the patient to somebody, you are referring the patient for further evaluation. But what further evaluation is needed? What exactly is needed from that doctor? You can mention, for example, in bronchogenic carcinoma, I'm sorry, in bronchogenic carcinoma, what is important? endoscopy is important, laryngoscopy is important, or maybe you are referring the patient for a lung biopsy. So you can mention that whose sign and symptoms are consistent with bronchogenic carcinoma, and your further evaluation would highly be in. You can alternate it with or you can just skip it. You can just skip it. You can just say signs and symptoms are consistent with bronchogenic carcinoma, and now I'm referring the patient for lung biopsy. That's it. In the next, when you are ending the letter, in that paragraph, you can also mention. You should always mention that your further evaluation or your assistant or your expertise in this manner would be highly appreciated or will greatly benefit with the patient. Understood?
Sir, sir, can we write like this that I'm writing to refer Mr. John whose sign and symptom are consistent with bronchogenic carcinoma and requires you further evaluation in terms of lung biopsy.
Yes, you can write that. You can write that. You
Okay.
can write that.
And then,
So,
sir, I made a order like this that after this, I will write that initially Mr. John was presented on this. I will write the first, and then the next paragraph, I will write that on the subsequent visit. So, sir,
okay.
after the on the subsequent visit, we have to write the date also.
You can write if there are so many dates is for example, if there are like 5 to 6 visits, you should not mention those 5 to 6 dates. But if there are only 2 to 3 or maybe 2 dates, you can mention that on subsequent visits, like on 5th September he presented with this, and on 10th of September he presented with this. But if there are multiple visits, like 5 to 6 visits, you should not mention the dates. You can just mention on subsequent visits he has presented with let's say bloody cough and sometimes with shortness of breath. You should not mention those dates because it's going to consume your time and it's going to consume the number of words in the letter as well. You will stretch it. Anybody has any other question? Anyone, any question? Okay, guys, so I'm going to end the session. I hope I was helpful. I hope you guys have understood the basic of writing, how to attempt, and what is important and what is not important. Okay, I'll be giving you a task, and then please submit it by Sunday evening, and I will be giving you another task before the next writing session, and we will be discussing those two letters in the next writing sessions as well. In that manner, your writing will be improved, and subsequently, I will keep on giving you examples of letters like this. So I'm going to end the session, and the files, the yesterday files and recording, everything will be shared with you in the group by the admin. Okay. Thank you for your time. And just lastly, if anybody has any question, please tell me before I end the session.
Sir, sir, after writing on the subsequent visit, we have to use the small letter
On subsequent
like
visit,
he was
subsequent
present.
on subsequent visit, then you put the comma, and yes, after the comma, you will use the small letter.
Okay.
Okay. Okay, perfect. Okay, guys, take care of yourself, and we will meet tomorrow, inshallah. And Dr. Tavinder, no problem, Dr. Tavinder. Even my English is very weak. It's no problem. Okay, just keep working on yourself, and you are good to go. Actually, it's not very bad. Okay, what you are doing is you are trying to cram the sentences, and you are just trying to do that as well. So please do not cram it. Okay, just try to improvise yourself. Try to write the letter try to speak according to the situation. You do not have to cram specific sentences just to put that in the letter or just to speak it out in the session. And Dr. Mancha, you do not have to worry about that as well. Okay, see, English is not our first language, and this is actually the reason we are sitting this test. Okay, they are not going to judge you. They already know that it is not your native language. What matters is that if you are being clear, and if you are being if you are using the right word and right sentences. Okay, what my advice is, be confident in yourself. You guys have gone through medical education, you guys have gone through 15 16 years of education, and all of that was in English, so it already shows that you guys have enough grasp on English language. What you guys are lacking is actually confidence and maybe sometimes a little bit of direction. So please, please, please do not underestimate yourself. Do not underestimate yourself. You guys already are very good. If you guys are able to understand me while I'm speaking in English, it shows that you guys are capable. You guys actually have a very good English skill as well. So please, please do not underestimate yourself. And with time, I'm here to help you. We will improve a lot. Okay, please do not worry about that. Anyways, take care of yourself, and we will meet tomorrow, inshallah. And I will share the task and everything with you guys in the group. No